Hello and welcome. You're watching Friday's edition of COVID-19. 40% of confirmed cases in recent days here in Korea includes those in their 60s and above. We plan to delve into this grim reality later on in our studio session today. First, here are the latest numbers on the pandemic with our Kwon So-ah and related news with our Oh Jung-hee. So, how are we ending the work week on the local front?
Well, Sunny, there were some concerns after we had a rise in cases to the mid-100s on Thursday, but the numbers have declined again. But again, it's still not enough.
Right, indeed. We have the Chuseok holiday coming up and the numbers are still hovering in the triple digits, right?
Exactly, and that's also why health authorities are calling on extra vigilance, especially in the metropolitan region this weekend. And they are also aiming to establish a so-called 집콕 culture. And this term is used to describe a lifestyle of spending your time exclusively at home instead of venturing outdoors. And in line with that, the government also promised plenty of culture and entertainment programs over the Chuseok holiday to enjoy online or on TV, and that to discourage people from traveling around. And especially, as I said, the figures are still in the triple digits. We can see that there's been not a dramatic change this week, but we do see an on-week drop by 50 cases if we compare today's number to last Friday's number. And with that, the total amount of cases in the country stands at 22,783 with 126 cases added this Friday. 377 is the death toll we're seeing right now, and some 2,600 people remain in quarantine, with over 19,770 people having made a full recovery. Now let's take a look at where these cases have emerged this Friday. Around 90 cases in the metropolitan region, with 46 in the capital, 37 in nearby Gyeonggi-do province, and around a dozen places around the country have been affected, even Jeju-do Island with 2 additional cases. And 17 cases this Friday were from abroad. And speaking of which, let's take a look at the global figures. 30.3 million people in total around the world have been infected with COVID-19, with over 950,000 fatalities and some 22 million recoveries. And let's take a look at the major hotspots around the world. India with 5.2 million added again around 97,000 new cases in just a day. That's about the same the country saw the day before. And also many Latin American countries, apart from Brazil, also Colombia and Mexico have been hit hard, with Mexico especially having a high fatality rate and also many sacrifices by health workers. In fact, according to the World Health Organization, around 1 out of 7 people around the world who have been infected are medical workers. Meanwhile, Argentina has surpassed the 600,000 mark. And if we go over to other places, we also see that Iraq has been seeing resurgences in cases, having surpassed Pakistan now at 307,000 cases. And our Oh Jung-hee will also look into details of countries that have been hard affected around the world. And I'll be back later after the government briefing. Sunny?
Right, so thank you for that. I'll see you back at the desk. Right, for more on the latest with regard to the pandemic here in Korea and elsewhere around the world, I do have our Oh Jung-hee here in the studio with me. Welcome, Chung-hee.
Good afternoon.
Chung-hee, the level 2 guidelines in areas outside the Greater Seoul area are poised to end this weekend. Has the government come up with a decision on what to do with this level?
Right, Sunny, currently level 2 social distancing measures for regions other than the Greater Seoul area were to be in effect until this Sunday. But the Chuseok holidays are coming up in less than 2 weeks. Though the citizens are aware that moving to other areas during the holidays is not recommended, many are planning to do so nonetheless. And we have already seen hundreds of thousands of people booking tickets in accommodations for the period. And that's why the government isn't likely to terminate its distancing measures. The authorities say that it'll decide this weekend what to do with the current measures. In the case of the Seoul metropolitan area, level 2 social distancing measures are in place until the 27th. The authorities are continuously asking people to refrain from traveling and stay home.
Another concern for health authorities here, Chung-hee, is the rising number of untraceable cases, right?
That is right. I mean, for the past 2 weeks, there have been 2,013 new cases of COVID-19 reported across the country, and 532 of them were actually categorized as those with unknown epidemiological links. Now, that takes up about 26.4%, the highest since health authorities began compiling relevant data in April. The figure surpassed the 20% mark in mid-August as cluster infections spiked in the greater Seoul area. While it's really important to identify as quickly as possible the sources of transmission in those who were in contact, the growing number of untraceable cases could make it more difficult for the authorities to track down secondary infections. And this also means that COVID-19 is spreading at a faster than expected pace in local communities, and people can contract the virus unwittingly.
Indeed. Now, that is something we have to keep our eye on. Let's turn to the international front now. Chung, I hear Israel is struggling to deal with a fresh outbreak of infections.
That is right. On Wednesday night, Israeli health authorities announced that the country actually reported over 6,000 cases in 24 hours. Now, that's for the first time since the outbreak began in that country. The country has seen nearly 3,400 daily cases on average this month, and it has been rising steadily for the past week. A total of over 175,000 people have been infected in Israel to date. Now, this is a very grim figure, especially given its relatively small population of just over 9 million, meaning that 1 out of around 50 people in Israel has been infected with COVID-19. Israeli president apologized for the government's failure to contain the outbreak, saying it had let the public down and asked for forgiveness. In response to the outbreak, the country will be entering a 3-week-long nationwide lockdown starting Friday afternoon. Now, that's the second national lockdown. The citizens are forbidden to venture outside a 500-meter radius from their homes. Shopping malls and hotels will be closed down, and mass gatherings will be restricted.
Hopefully they'll be able to contain it in the near future. Meanwhile, the overall situation in Europe is also looking bleak, I hear. How are authorities there seeking to contain the situation?
Sunny, countries in Europe are now appearing to be leaning towards social distancing measures instead of imposing strict lockdowns like they used to in the early stages of the outbreak. Now, that's because lockdowns actually have dealt a significant blow to their economies, and also their citizens are becoming more weary and disgruntled by the national lockdowns. The virus is actually spreading rapidly once again in Europe as countries there have reopened their economies, especially those that rely on tourism. An average of 9,700 new cases are being reported in Spain on a daily basis, 8,300 in France, and 4,000 in the UK. And unlike the first wave of infections, more cases are being reported among younger citizens this time around. Meanwhile, Sweden has seen a steady decline in the number of newly reported cases. While other European countries were imposing strict lockdowns, Sweden took a controversial herd immunity approach, keeping schools and churches open. But the jury is still out on whether Sweden's falling caseload can be attributed to its no-lockdown strategy and if it's a viable approach for other countries to follow.
I see. Well, I suppose only time will tell. All right, Chongi, thank you for that coverage. Hope to see you again soon.
Thank you. My pleasure.
Right, it's a little after 2 o'clock in the afternoon here in Korea, and we are poised to join the regular briefing on COVID-19 by authorities here. Chung Eun-kyung, the commissioner of the Korea Disease Control and Prevention Agency, has pointed to the upcoming Chuseok holiday as a period of much concern. Now, this lunar autumn holiday, which is traditionally a large family event, is poised to begin on the 30th of September and to end on the 4th of October. While authorities have urged members of the public, as we've continued to report, to refrain from traveling and from gathering in large numbers, it appears that quite a number of the people are planning to venture beyond the boundaries of their homes. In fact, industry findings show a rise in the number of related reservations for trips to the southern resort island of Jeju, the southern port city of Busan, and Gangwon province. Now, in light of the reality that untraceable cases, as our Oh Jung-hee mentioned, account for more than 26% of all recent infections, health experts are choosing to claim that ignoring social distancing at this particular time may trigger a frightening outbreak. Now, we are still waiting for that briefing to start, and perhaps while we do, we can take a look at the guidelines under Level 2 social distancing currently in effect across the country. Gatherings of more than 50 people indoors and 100 outdoors remain banned. Professional sports games can take place in the absence of spectators at stadiums. Operations at high-risk establishments, including buffet restaurants, clubs, bars, singing rooms and cram schools of more than 300 people remain suspended. Internet cafes, however, have been removed from the list of high-risk venues and are allowed to open but cannot accommodate minors nor serve light meals. The ban on in-person religious activities remains in place and no visitors are allowed at homes for the elderly, given the vulnerability of these people, and remote working is strongly advised for those who can do so. We are still waiting for the briefing to start, and perhaps while we wait, we can take a look at the daily figures for this Friday here in Korea, as reported by our Kwon earlier on. We have 126 new cases here in the country, and from those cases, 17 of them have been imported from overseas. Our total number of cases stand at 22,783. We've lost 5 more lives today on this Friday to raise our death toll to 377. Authorities believe the death toll will continue to rise as quite a number of those who have been confirmed with COVID-19 now stand in their 60s and older. Those in quarantine, we have the number standing at 2,635, while those who have fully recovered stands at 19,771. Now we understand the briefing is about to start. We'll come back to you afterwards.
First of all, we have Mr. Kwon Junuk with the briefing. Let us now begin a regular briefing on the COVID-19 response here in South Korea for September 18th, Friday. As of today, midnight, we have a total of 109 new local infections and 17 new imported cases. The total caseload now stands at 22,783. 228 more people have been discharged following full recovery, while 2,635 people are in quarantine undergoing treatment. We have 150 patients with severe or critical conditions. We had 5 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at our domestic infections by region in detail. And depending on the accumulation data time, some of the numbers are subject to change. And starting from the Seoul metropolitan city, regarding these August 15th Seoul rallies, we have 5 more cases being confirmed. In total, we have 609 cases. And we have 336 people who are from non-metropolitan areas, which is more than the number of residents in the metropolitan area. In relation to K-Health Industries, we have 5 more cases being confirmed, increasing the total to 32. In relation to the National Tax Service, we have 4 additional cases being confirmed, and we have 5 cases being confirmed to date. In Gyeonggi-do Province, in relation to the Baegwon, which is a mental health care facility in Gyeonggi-do Province, we have 7 additional cases being confirmed. In total, we have 18 cases being confirmed to date. And in Bucheon City, we have a Nambu Church. In relation to this church, we have 2 additional cases being confirmed. In total, we have 17 cases to date. And in Gwangmyeong City, we have the Kia Motors factory. We have 2 additional cases. The total now has been increased to 13. And in relation to Central Hospital in Siheung City, after we had the first case on the 9th of September, we have 6 more cases being confirmed. The total now stands at 7. In relation to the Marine Science High School in Goryeo City, Chungnam Province, we have additional cases being confirmed there. And in relation to an office building in Iksan, we also have 1 additional case being confirmed. In total, we have 10 cases being confirmed to date. And as mentioned before, we have a total of 150 patients with severe or critical conditions, and 132 of them are above the age of 60, accounting for 88% of the total. And among the death total of 377. A majority of them are above the age of 60. And as we mentioned before, there is a high risk of development of severe symptoms for the senior citizens above the age of 60. So we ask you to refrain from going outdoors and minimize social contact with others. If you have to step outdoors, please wear your face masks at all times. If you have a fever, if you have fever and respiratory symptoms, if you also have a muscle pain, as well as other respiratory symptoms, and if you have sore throats, and if you do not feel good, please visit the screening clinic as soon as possible to get tested. And next, let us now look at the number of imported cases. We have 17 new imported cases as for the countries. We have 4 from Uzbekistan and the US respectively. And next, we have some updates on our R&D process. As for the remdesivir, 409 patients have been administered with the drug across 58 hospitals here in the country. And as for the live quarantine measures, the Safety Ministry is operating the Safety E-report right now, and we have some major updates of the reports that we have received, and here are some examples. Of course, these are subject to final confirmation, but we would like to share some examples, and we would like to increase the alarming bell as well. And there were also many people who were gathered at the restaurant, and many of the staff members did not wear face masks. And at a business operation site for medical equipment, many people were enjoying these medical equipment. However, they did not wear face masks. And please note that at restaurants and cafes, as well as other multi-use facilities, they need to always ventilate the space on a regular basis, and we need to also comply all of the staff members and managers to wear face masks at all times. And during the weekend, we ask you to refrain from going outdoors, and if you have to step outside, please wear your face mask at all times. In particular, as we have mentioned in the example of the Safety E-report example, please refrain from going to business seminars that are hosted by door-to-door sales services, as well as other similar seminars. Please refrain from visiting these places, as they could be very crowded and enclosed environments. And during the weekend, we would like to also analyze, to show you the example of the analysis for the infections in the religious factors. However, we have 4 religious facilities with 56 total infections so far in the recent days. And as for the risk factors, we have noted that they had in-person services without regular ventilation, and also they had many gatherings of social meetings, as well as small group meetings and group dinings as well. And they also engage in dialogue without wearing face masks. So once again, we highlight that during the weekend, please take a particular precaution at religious centers, and please carry out all of your meetings via non-face-to-face means, and please cancel and postpone all of the small gatherings as well as group meals. Last but not least, we would also like to note the following. COVID-19 occurrence is also being prolonged, and it is also increasing at a very fast pace as well. And during looking at the past 2 weeks, we have some effects of the past social distancing measures. However, we believe the latest outbreak was centered around the metropolitan area, and meaning that it has spread to the entire nation, and therefore, compared to any other previous outbreaks here in Korea, this current situation is most dangerous and risky. So we would also like to continue to note that you could be exposed to cluster infections at any place where it's crowded and confined. And if there is a major outbreak in these crowded places, it is very difficult for us to contain the virus. So the current situation is just like a spring that can also have a major
특별히
uptick
실내는
in the
물론
number of confirmed
거리두기가
cases.
불확실한
So we ask you
시에서는
to take particular
어디서나
precaution,
마스크를
especially
착용하는
indoors
것이 매우
and when you are
중요합니다.
outdoors, even when you
이번
cannot
기회에
keep a healthy distance with others,
억제해야
you need to wear
독감
face
예방
masks at all
접종도
times.
가능하고
We
또
need to
언젠가
contain the
이루어질
virus right now
코로나19의 백신
so that
접종
we can
사업도
also contain
차질 없이
the
진행할
influenza
수
outbreak
있습니다.
in the winter time as well.
그동안 매번
And we also
코로나19의
would like to
위기를
continue to note
이겨내왔고
that we
또
have
피해를
been
줄이는
overcoming
데
the challenges
기여해
posed by the
주신 것은
COVID-19
우리 국민
during the
여러분들의
past
저력,
months. And
인내,
this was all possible
위대함입니다.
thanks to
저희
the energy, the
방역당국을 이를
potential,
믿고
as well as
국민들께서
the full
계속
efforts that were
추천해주고
exerted
계신
by
데
our
대해서도
members of the public.
힘을 얻고
And we
있습니다.
are also very encouraged
지금
by this
유럽을
fact.
바라보면
Looking at
지난
Europe, many
3월에
countries there,
제1차
they had the
코로나19
first
유행의
outbreak in
정점을
March.
지나서
They had
더
the
큰
peak,
유행의
and now they
크기를
are
보이고 있는
also
상황입니다.
witnessing a larger
당장
outbreak.
세계보건기구도
And the
지금의 유럽
WHO also
상황이
says that the
지난
current
3월보다
situation
더
in Europe
위험하다고
is
얘기하고 있습니다.
is actually more
전 세계
risky
많은
than
전문가들이
that of March.
국방부에서
And many of
동절기에
the
2차
experts in the
대유행
Northern
가능성을
Hemisphere, if they
예측했지만
have forecasted
사실상
that
전
another
세계는
second outbreak
지금
could occur
당장이라도
during
겨울이 되기
the winter.
전이라도
However,
또 다른
before we
대유행이
go into a
가능하다는
winter,
점을
we
우리 모두
are
알게
exposed to a
되었습니다.
large outbreak at any
추석
time.
연휴를 앞둔
And ahead of
우리나라도
the
이를
Chuseok
위험
holiday here
신호로
in South
받아들여야
Korea,
합니다.
we need to also
전
stay vigilant
세계에서
continuously.
봉쇄를
And
풀어나가면서
the
또한
nationwide,
봉쇄를
many
푼
countries,
후에
globally, many
코로나19
countries
유행을
are
제대로
easing their
관리하고 있는
lockdowns.
나라는
However, there
찾기
are
힘든
very
상황입니다.
few countries actually.
그만큼
Rarely
코로나19
they are
힘들고
having the
어렵다는
situation under
의미입니다.
control entirely. So
거리두기
this means
강도를
that
조절하면서
controlling and containing the virus
완전한
is
봉쇄로
very
가지
difficult and challenging.
2차 유행이
Therefore,
생기면 그
as
초기에
we have the
전체
second
국민들의
outbreak, we need
적극적인
to
참여로
also ask
유행을
all of the
억누르려
members of
노력하고
the
있는
public
우리의 현재 상황은
need to
전
comply with
세계적으로
the
오히려
quarantine
드문
measures.
상황입니다.
And it is very rare to
국민
find such a
여러분들의
case
이해와 협조가
globally.
없다면 사실
And we
불가능합니다.
believe that this is actually
일선의
impossible with the
보건
help and cooperation of the
지방자치단체에
public. And
수고하시는
many
일선
of the
공직자
public
여러분들,
officials
그리고
in the central and the
무엇보다도
local
의료진
governments, of
여러분들의
course, as
헌신이
well as
계셔서
the
가능한
dedication put
일이고
forth by the
앞으로도
medical practitioners
계속
were also
길어질
something that we need to
이러한
highlight.
헌신과
And also,
다시 한번
we would like to
머리
once
숙이게
again
됩니다.
appreciate all of your
가을이고
efforts
청명한
that you have exerted up until
날씨임에도
now.
불구하고
Despite the great
자영업자분들,
winter
택배기사님,
of the
또
autumn, there
생업에
are many
종사하는
people,
많은
including the
분들에게는
self-employed,
사실
as well as
너무도
the
잔인한
delivery
시기이기도
workers.
합니다.
Many people are going
그럼에도
through great
불구하고
challenges right now.
이겨내고 또
Nevertheless,
극복할 수
many
있도록
people are
저희
overcoming the
방역당국도
virus and overcoming the
더한층
difficulties
최선을
as well.
다하겠다고
And we will also
다짐드립니다.
exert our full efforts going
지금부터
forward. Thank you very
기자님들
much.
질문에 답변 드리는 시간 갖겠습니다. 출입 기자단으로.
Right, that was Kwon Junuk, the director of the Korean National Institute of Health, with Friday's afternoon briefing. Soa, what was the gist of his address?
He had a number of renewed messages, but of course essential messages ahead of the weekend to abide by social distancing measures and not move around if possible, especially before the Chuseok holiday and also the winter season coming up. And also because we are having a high percentage of people that are elderly people and have been affected by the COVID-19 virus. In fact, currently we have 150 people in serious or critical condition, and 88% of recent infections were patients above the age of 60. So this weekend, again, vigilance, and also be careful at restaurants and also when you're attending religious services, which you should try not to attend, actually.
Right, okay, Soa, thank you for that. Have a safe weekend. See you on Monday.
You too, thank you.
Right, under level 2.5 social distancing, franchise coffee shops were only allowed to offer takeout services. Now, given the ease in distancing to level 2, such coffee places are open to patrons amid stringent precautions within their premises. I have our Chun Song-cho at one such establishment. Hello, Song-cho.
Good afternoon, Sunny.
I see you're at a cafe today, Song-cho.
Yes, I'm at the Seongsu branch of Cafe Bene, a popular franchise coffee shop here in South Korea. Well, this place was actually quite empty up until last weekend because they're only allowed to accept delivery and takeaway orders. It was part of the strengthened social distancing guidelines, which were upgraded and kept at level 2.5 for 2 weeks. But much to the relief of business owners, the level has been eased down to level 2 starting this week, and and since then, it has been business as usual for franchise cafes in the Seoul greater metropolitan area. However, business as usual means quite different these days, right? I mean, because the businesses have to follow the minimum standard of quarantine measures, and just making ordering a cup of coffee can entail many different steps for customers. So to give you guys a better idea of what it looks like, I'll walk you right through it. So let's get inside. So first of all, notice how the windows and doors are kept open for better ventilation. And once you step in, the staff member, first of all, will take my temperature. And of course, my facial mask is a must. If you don't have one, then you'll be denied entry. 안녕하세요.
안녕하세요. 온도 체크 도와드릴게요.
네네.
46.8도세요.
All right, I'm 36.8 degrees Celsius, which is considered normal. All right, and then I will register my contact information and name using this QR code scanner. So basically, it's like an electronic entry lock. So here you go. All right, I have to make sure. Okay, so my QR code has been accepted. All right, so let's get inside. And don't forget to use hand sanitizer. Okay, so now that we're in, we've actually cleared the first hurdle. Notice there are stickers on the ground, right? So these indicate how far away you have to be away from people, even when you're standing in line. And since there are no people, I'll just straight away order my coffee. 안녕하세요. 저 아이스 아메리카노 한 잔 주문할게요.
매장에서 음료를 드실 때 제외하고는 마스크 착용을 부탁드릴게요.
네, 감사합니다. So I was just told to keep my masks on, except for when I'm taking sips of coffee or eating food. 감사합니다. And I already paid for my drinks, so don't worry. Okay, so let's take a seat. Well, actually, the store has a very rigorous disinfecting routine, performing it on an hourly basis, a total of 17 times every single day throughout the day. So let's see. So she is spraying the disinfectant spray and cleaning basically every surface you can find in the store. And then I just took a seat. And if you look at the table, there's a sticker right here too, which indicates that you're keeping social distancing even when you're sitting down. And like I said, you have to keep your masks on at all times, even when you're having conversation with other people. So the rules are quite straightforward, aren't they? But let's find out more about what other measures are in place from the staff member here, Barista Kim Hyun-soo. She's joining our show and with my drink prepared. 감사합니다. 안녕하세요.
Hello.
Hi. All right. So other than the measures that I've just explained to our viewers, what other changes has the store implemented because of COVID-19?
Yes, thank you for the question. In order to encourage non-face-to-face purchasing, Cafe Bene enabled smart pre-order through app, expanded delivery available stores, and installed kiosk order systems. For the safety of our customers, we changed our current best menu pingsu into single portion cup pingsu.
All right, so that's a lot of measures. Is there anything you'd like to add to highlight to the potential customers?
Yes, currently COVID-19 prevention guidelines are well kept by our customers. We advise our customers to follow our future instructions regarding COVID-19.
All right, thank you so much for your time.
Thank you.
Thank you, and thank you for the drink. All right, so it's time to take a sip of my coffee. I can't wait. I just ordered iced Americano. Okay, so this is only when I am allowed to pull down my mask. It's very good. All right, so the relaxed rules doesn't mean by any stretch that we can let up our vigilance even one bit. So let's always be aware of the risks in going outdoors and precautions that we can take to minimize them. This has been Chun Sung-cho reporting live from Seongsu-dong, and back to you, Sunny, in the studio.
Right, Song-cho, that coffee looks good. As always, thank you for your coverage.
격리 중인 확진자의 연령 분포를 보면 60대 이상이
거의 40% 가까운 1,300여 명이었고 고령자들께서는 각별한 주의가 필요한 상황입니다.
연령 구조를 봤을 때 60대 이상의 규모가 그렇게 많이 줄고 있지는 않습니다. 그래서 이 줄어드는 그 규모가 크지 않기 때문에 신규 중증 위중 환자의 발생은 당분간 어느 정도 수준으로는 이어질 것 같다라는.
Findings show 4 out of 10 who've tested positive for COVID-19 in recent days are in their 60s and above. And as tangible proof of the danger of this trend, more than 40 patients in that age group have lost their lives to the virus this month alone. For more on this grave reality, I have Dr. Alice Hyun-Kyung-Tan from Ms. Mary Women's Hospital here in the studio. Welcome back, Dr. Tan.
Thank you.
And in the spirit of social distancing in mind, I have Professor Lee Han-sung from Yonsei University live on the line. Hello, Professor Lee.
Hi, thanks for having me.
Right. Dr. Dan, we'll start with you then. For the past 2 weeks, the number of confirmed cases here in Korea has been hovering within the 100 range, but on a more grim note, the triple digits number has been with us for the past 1 month. How do you assess the latest situation here in Korea?
Well, in some respects, we are in a much better position now than we were back at the end of August. For example, on August 27th, we had the highest number of daily new cases since the Shincheonji outbreak at 434 such cases. And that number today is 109. So we're in a better position in that regard. Also, the total number of active cases has gone down by more than 2,000 over the last 2 weeks. So from about 4,700 to now about 2,600. So that's also good news. The absolute number of cases of unknown epidemiological link over a 2-week period has also gone down by more than half in 2 weeks, from 1,280 to 532. So that's also good news. However, the rate of decline does seem to be slowing, and so that is a cause for concern. And there are other red flags on the horizon. For example, it would be incredibly disappointing if it were true, but we may have already passed the nadir, the lowest point of daily new cases, because that value was 91 this last Tuesday, 4 days ago, and we've already seen an uptick in the number of daily new cases. It's probably too early to say definitively, but because social distancing measures have been eased, we may be witnessing the start of the steady rise in new cases on our way to the next big amplification event, which is, of course, what we want to avoid at all costs. Importantly, the number of severely and critically ill patients has not really changed at all in the last 2 weeks. That number has stayed at 163 plus or minus 12. There's really been no improvement. And the number of deaths over the last month, that's 74 fatalities, represents 20% of all the deaths due to COVID-19 over the last 8 months since this began in our country. And so what's most ominous, though, is that of the 160, 150 severe and critically ill patients, 85.6 are aged greater than 60. So that predicts that in the near future, there will be even more deaths. I heard on social media recently that somebody said, if the demographic tables were reversed, and instead of 160 senior citizens in severe and critical status, it were our children in that situation, 160 of our children who were in ICUs and on ventilators, and surely, undoubtedly, our grandparents would do everything possible to make sure that the children survived and to prevent more kids from getting sick. So I think we do owe it to our elders to do everything we can to try to get this disease under control and to protect them from getting sick.
Of course, I have to agree with you, Dr. Tan. Professor Lee, which is why among the high-risk venues of cluster infections are nursing homes and hospitals. In fact, the hospital that you are at was no exception. Please tell us about the situation there now and about the measures in place to prevent a similar scenario in the future, Professor Lee.
So I believe that we have the situation under control. Our response has been consistent with the guidelines set forth by the CDC, which includes identification and isolation of the cases, close contact tracing, and rigorous testing, which has led to breaking the transmission chain. I can't say that we're out of the woods yet, but we're getting there, but we'll still have to wait a couple more weeks to see if we did, overcome this infection.
I see. Dr. Tan, you mentioned, of course, the rise in elderly patients as well. And let's take this moment now before we delve further into the issue to remind our viewers and perhaps ourselves as well about the dangers faced by the elderly when they are exposed to the virus.
Right. So the elderly, they suffer disproportionately from the greatest negative effects of COVID-19. So, for example, 1 in 5 persons greater than 80 years old, if they are diagnosed with this disease, they will die. That case fatality ratio is 6.8% for people in their 70s and 1.18% for people in their 60s. Still, this number sounds low, but it's much, much higher than, say, the case fatality ratio for the seasonal flu. So they are at very high risk for death. And this pattern is represented again in terms of the chance for progression to severe and critical illness. As I said, 85%, close to 86% of the cases in this category, the sickest of the sick, are greater than 60 years old, 60 years of age or older. And so they really do need to be very careful. I think as the pandemic wore on, the elderly members in the community, they were at greatest risk for isolation and loneliness, and that made them perfect targets for direct marketing schemes that offered very cheerful entertainment, free food and drink, and promises of great health if they purchased these healthcare products, and that made them vulnerable to these direct marketing amplification events. Also, for a millennial, it's very easy to say, click online for worship, do it online. But for an elderly person, this may not be a viable option. And so they resorted to the really only option that they had, which was the riskier alternative, going for in-person worship. And that, of course, increased their chance of being exposed to the disease.
A very sad reality. Now, for those who do survive the battle against the virus but suffer from the after effects, including lung and heart problems, a new research shows there is hope for recovery. Now, for more on this optimistic finding, I have Dr. Ivan Tanchevsky live on the line from Austria. It's a pleasure to have you with us, Dr. Tanchevsky.
Hello. Hello from me.
Right, Doctor, I understand your contributions in the medical field have been highly acknowledged. Do start by telling us about this recent study that you were involved in.
We how the lung damage in COVID-19 survivors would evolve as to whether damage would evolve.
Professor, I think you're breaking out. Could you speak perhaps a bit louder? We can't really hear you.
So we designed the study where we wanted to follow up our patients at several visits. It is 6, 12, and 24 weeks after discharge from hospital. And the main findings are that at that after 6 weeks after discharge from hospital, still 88% of patients had lung abnormalities, so abnormal CT findings, computed tomography findings, and that around 47% still had dyspnea, which means shortness of breath. And however, the good news is after 3 months, both the CT findings as well as the clinical findings will improve.
I see. Well, that is good to know. I believe our panelists here in the studio and online have questions for you too. Dr. Tan, perhaps we can start with your question for Dr. Tanchevsky.
Thank you, Dr. Tanchevsky, for joining us here in Korea, and thank you for presenting your very valuable results to the scientific community. My question is, I was wondering if you were able to perhaps follow this lung CT images serially, starting from when the patients were in hospital during their admission, and were there any patterns perhaps with the most severe lung damage on CT during admission leading to the longest duration of abnormalities found on follow-up?
So we have a subgroup of patients where we have these serial CT analysis, and in this subgroup of patients, we found that mainly those with consolidations and severe or diffuse ground glass opacities, which are typical for COVID-19 or for a severe course of COVID-19, will be those patients who will take longer to recover. But however, even though there are these patients with higher lung damage at entry into the hospital, they will recover at a similar rate like patients with a milder clinical course. So they will take longer, but they will recover at a similar pace as other patients.
I see. Professor Lee, I believe you also have an inquiry for Dr. Tanchevsky.
Yes, Doctor, thank you for sharing your perspective. I have one question. My understanding is that not all the patients experience these long-term complications. Are there any prognostic factors leading to these long-term complications or abnormalities in the CAT scans?
So that's a really good question. The point is, our study was not designed to answer this question, so we may be statistically underpowered. So we needed much more patients to understand this issue. However, there are some comorbidities which are strikingly elevated in our cohort, which is obesity, of course, cardiovascular disease, and diabetes. So this metabolic syndrome patients appear to take longer to recover. However, we can't make any statistical analysis to prove this. And on the bottom line, we just can't say right now that those more severely affected in hospital will take longer.
I see. But the good news is they will recover then. There is a chance that they will recover their lung and heart problems.
Sure, yeah.
I see. All right, Dr. Tanchevsky, again, thank you very much for joining us at this hour with your thoughts. Professor E, I understand researchers here in Korea also conducting follow-up studies on patients who have been in hospital for treatment of COVID-19. Do tell us a bit about the importance of such studies.
So I think it would be important for the patients and their families to understand what to expect during the natural course after a recovery from coronavirus infection. The information would help the patient decide when to seek medical help if symptoms do appear, and the physicians can decide when to intervene to prevent some disorders or decide to administer treatment. And also these studies, if they are done adequately, can help us better understand the coronavirus infection itself and its pathogenesis. And it may also give us clues on how to treat the illness in the end.
Right. Dr. Tan, here in Korea, as mentioned during the briefing this afternoon, the anti-Ebola drug remdesivir has been administered to about 409 critically or severely ill COVID-19 patients. How effective has this treatment been so far?
Well, we can't make reliable statements regarding the safety and efficacy of a drug outside of the context of clinical trial. Due to the challenges of the pandemic, there have only been 4 clinical trials using remdesivir so far, including one that was recently published that included patients from the Seoul Medical Center here in Korea. In terms of the answer to your question, and that's what's on everybody's minds, will the use of remdesivir lead to lives saved? Unfortunately, that definitive answer is still elusive. The results of the 4 clinical trials that have been published to date, they're kind of going a little bit back and forth. Some suggest that there is effect. There's an effect if you use it only for 5 days, but for people who used it for 10 days, that effect seems to be less. So it's very difficult to draw conclusions at this point. Here in Korea, as you said, we've had about 400 people who have received the medication. Not all have survived, but we cannot, unfortunately, draw conclusions from this data because a lot of the patients, they receive the medication outside of the context of a clinical trial.
I see. And very briefly speaking, against that backdrop, Professor Yi, one final question. The WHO, meanwhile, is recommending the use of affordable daily steroids to treat severely ill patients. Please tell us more about this recommendation.
Well, many of the patients with severe disease is thought to undergo excessive inflammation, which can cause damage to an organ or even failure. Steroids, which has anti-inflammatory properties, is being widely used in medicine to treat some hyper-inflammatory states or diseases, so therefore can be used in severe coronavirus infection. Although it can be effective, many people are reluctant to use it because it has some established side effects, which include hypertension, diabetes, osteoporosis, depression, and sometimes severe suppression in the immune system, which warrants careful use. So people know it's a very, very good drug. I like to clarify that it's not a treatment for coronavirus infection, but it can help calm down the excessive inflammation associated with the infection.
I see. Well, that is good to know. All right, Professor Lee, thank you very much for your thoughts. And Dr. Dan, as always, thank you for being with us today.
Thank you.
Thank you.
Right, well, that brings us to the end of this week's edition of COVID-19. The weekend is upon us, and while the frustrations that you're feeling are normal and understandable, authorities are nonetheless urging yet again for the public to refrain from outdoor activities to ensure a tangible decline in the daily numbers of COVID-19 infections here in the country. Do have a safe weekend.